heading to the stem cell transplant center. All four of us, me and my 3 siblings. The youngest one can't go with us because he's not up to 16. So we're going for the HLA test, which is the fancy test that finds out who's the best match for me to give me the stem cells. And they're gonna draw some blood from me too today. So yeah, but I'm so tired. Don't mind this makeup. It's just packaging. Yeah, because I'm sleepy, I'm tired. I only got 30 minutes of sleep because from work I went mini grocery shopping for just some things that we need in the house. But I'm so tired, man. Yeah, and thank God I'm not working tonight. Hopefully I get to sleep. Hopefully my circadian rhythm allows me to sleep, because sometimes my body wakes me up at like 1 a.m. or 3 a.m. and I'm not able to sleep again. So, and then throughout the day I can't sleep because on a normal day I can't sleep. In the afternoon, if I sleep in the afternoon, then I'm about to be sick or I'm really tired. But this sun, like, no, I can't sleep during the summer in the afternoon. Yeah, but let's see what the HLA test has in store for us. Let's see who's the match. Yeah.
Called your father now.
I'll make way. Go ahead. I'm Z.
From your birthday? Okay.
Pretty much stops in the middle. Good back. Okay, stop this man. Okay.
Yeah, yours is like just red. Mine is like.
Not you saying it led to marry. Sorry. Thank you. One more. Sorry. Are you crying? Eh? Sorry. Last one.
trust is better than me.
Okay, so we're home. We are home. And I'm gonna give you guys remaining information. Man, these girls make too damn much noise. Like, they make so much noise. All right. And then they gave my brother David this paper, so I'm just gonna let you guys know what happens as a stem cell donor, what to expect. Okay, water break. So I have the paper here, and so it says stem cell donor information. So it says I'm just gonna read through it and give you a summary. So basically, they take blood samples. Like, they took lots of blood samples. Like, there was like about 6 vials per person. And when I asked the phlebotomist, I was like, so this test, are they gonna redo and recheck each person's genotype and blood type? And she said yes. I said better, because you know, our African parents or our Nigerian parents be telling us, oh, you're AS, oh, you're AA. Sometimes they are mistaken, or the test they did in Nigeria are totally flat out errors or mistakes. Sometimes they give you someone else's what do you call it, someone else's test results. For example, my mom, when she did her genotype testing when she was still a spinster before she met my dad, so she did her test, and the result that came out, they told her that she was AA genotype. So when she went back, she was like, okay, I'm AA genotype, I've got premium blood. That's what I call it, premium blood, AA. Only for her to get married to my dad. My dad already knows that he's AS, so she's like, okay, well, I know he's AS and I know I'm AA. We don't have to do a retest. That's why you have to do a retest when you meet someone new. You know, ask them, hey, before you start falling in love, ask them, what's your genotype? This is what I got. You know, if they tell someone, some Nigerian man will tell you, hey, I'm AA, O positive. Show me paperwork, baby. Show me results. Nah. And then they got married. They had me. I mean, look at this picture. I was healthy, and my mom, she likes to do her kids genotype testing as her first daughter. She started off with me, and it came out that my blood genotype was AA genotype, and I looked it. I was never sick for a day. I never looked sickly. So by the time I was like 4 or 5 years old, you know how kids play in the rain and all that stuff, then I started having bone and joint pains and all that stuff. So she took me back to the same hospital where she had me and where she did the genotype testing, and they were like, oh, sorry ma'am, your daughter is SS. She's like, well, what are you saying? It's like, what are you saying? It's like, my friend do the test again, and they did it again and 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 SS. That's where I am now. Although people still don't believe when I tell them that I have it. I've only had blood transfusion once in my lifetime. That was when I came to the US. Throughout Nigeria, I never had blood transfusion. I was on herbs. I'll make another video of the herbs that I take that help me with the anemia and all that stuff. Herbs and fruits and vegetables. I'm gonna make another video of that. So, and then my mom was like, okay, if she's SS, then it means I'm not AA. So she did another test and she found out that she's AS. So she's like, F-U-C-K. She's like, what? Yeah. So that's how she knew that, okay, the Nigerian healthcare system is, I mean, we all know it's jacked up, but they gave us someone else's results. That's how they kill people, and they give someone else another person's HIV test results, and you think you're HIV, and you go and you're sleeping around thinking you're spreading it, only for you to not actually catch it. Bad luck for you. So back to this HLA testing. It's a bougie test. like, it's an expensive test and it's a bougie test. So they took blood from David, Naomi, and Ruth. They didn't take from Kachi, my youngest brother, because he's not up to 16. So, you know, consent and all that stuff, legalities and all that stuff. So the HLA test is basically it's called HLA typing. So they use it to check who's the best match, and then when the doctor verifies or determines who his candidate is for the stem cell donor, then they'll reach out to us, and then this is where I'm coming to. So they go ahead and call us, and then they start doing another series of tests on the chosen one, the savior. Yeah, that one. So they go ahead and do series of screenings and all that. I don't know what they're screening for, but they're screening things and screening. So here it says, what should I expect if I proceed with the donation process? The stem cell collection process, called apheresis. I'll leave the definition for apheresis down here. Can be done as an outpatient. You will come into the outpatient clinic for the first 4 days to receive injections to stimulate the stem cells. Stem cells normally stay inside the bone marrow and mature into various blood cells before being released into the bloodstream. We all know this in biology and anatomy, if you did that. And then there's a medication called, there's a growth factor which can also be given as a medication. It's called filgrastim. It's a growth factor that is used to increase the production of stem cells in the bone marrow or in the marrow. So this increases the production rate and causes the stem cells to be pushed out into the bloodstream where they can be collected. So on day 5, this is after 4 days of receiving those injections, day 5, the stem cell collection procedure will begin at 7 a.m. This is a whole procedure. At 7 a.m. the procedure can last about 4 to 5 hours, so prepare. If the arm veins are adequate, determined during the donor screen appointment, you know, that's if the veins in the arms are okay, the nurse will start an IV on each arm. So what happens, the nurse will then explain the process to the donor, the chosen one. And they'll stay with them throughout the procedure, because you know how basically if you're drawing out blood from someone, you have to be with them just in case if they become unconscious or become hypotensive. When they're hypotensive in the sense that their blood pressure drops, you have to watch out for that. Dizziness and all that stuff. They'll tell the person what to expect, or if they have this, what they should do. A family member can be with them during that stem cell collection procedure, and after the procedure is completed, they will be allowed to leave the clinic, and then the nurse will contact them later to know if they got enough stem cells. So if needed, if they need more stem cells, then that's what day 6 would happen. Then they will do another collection procedure the following morning. So the second day collection is routinely scheduled, but will be cancelled if adequate cells are collected on the first day. So here it says, should I anticipate side effects with the injections or stem cell collection procedure? So here it says filgrastim, which is the growth factor that's given to the donor. The filgrastim injections can be given in the arms, the legs, or the abdomen. The way I'm seeing this, it's probably going to be the filgrastim might be a subcutaneous injection. Subcutaneous means under the skin. It might be in the arms, probably in the legs, that's around the thigh area, or in the abdomen. Usually medications like that are usually subcutaneous, based on my experience with injections. I mean, giving patients injections. The injection may burn a little, when it's being administered. Yes, if it burns a little, then yes, I think it is subcutaneous. The most common side effect is throbbing, low backache, but they could experience bone pain here and there, because I mean, this filgrastim is a growth factor that affects production of stem cells in the bone marrow, and boom, that's the idea. Okay, they could have mild fever, chills, flu-like symptoms. Well, this can just be helped with regular Tylenol or the big name acetaminophen. In Nigeria, you could use stuff like paracetamol or maybe Panadol. Probably they're in the same class. And these symptoms subside within a few days after the last dose of the filgrastim is given. So I think the filgrastim is given for 4 days. Yes, the first 4 days before the collection, which is the 5th day, and maybe another collection which might be the 6th day. And then they might also experience some sensation of numbness, tingling around the lips, the nose, or generalized vibrations in the body. These numbness and tingling and all that stuff is related to the blood thinner used to keep the blood from clotting during the procedure. So from what I'm reading here, they still have to give them blood thinners prior to the collection or the harvesting of the stem cells, so that the blood will not clot during the procedure. So basically what my doctor told me is they're pulling out the blood from this arm. It's probably in a machine, like the way you have dialysis, something like that, in a machine, and then it's spinning it and it takes out the stem cells, and then it's pushing the blood back to the donor. That's what happens. What else? And then you could ask, people usually ask more questions like, oh, is there any other way to collect stem cells? Well, there used to be a traditional way of collecting stem cells, which is bone marrow harvest. Basically, they go and drill into the bone, the femur, like at the neck, close to the head, which is the ball of that hip joint. That's where it's usually produced, the bone marrow. So they go in there with a huge, long ossicle needle. Ossicle means bone. And then they go inside there, drill it out. It's very painful. And the risk of that one is, one, it's invasive. There could be risks of infection, and then healing time, and it's painful because as adults, it's harder for your bone to heal than a child. So they kind of like reduce using that, and you have to be under general anesthesia to do that because it's painful. I know what bone pain is like, so you can imagine someone going into your bone with a huge needle to take out stuff. Nah, I'm not doing it. No. And then when they take that out, as in this is the bone marrow transplant, they take it out from the donor and they push it back the same way into the receiver through the bone. But science is doing good and things are becoming better, so it could just be through, you just take it like you're taking regular blood. So I might have a port here, because usually anytime they want to draw blood, they have to like drill me, and they hit scar tissues every time. So I might at some point get a port either here or here until I'm done. And it's another question, do I need a routine follow-up after the stem cell collection is completed? So the answer here is, however, it's determined that you will be donating your cells, peripheral stem cells, or by marrow harvest. You can expect to get follow-up phone call from the team, the stem cell team. Generally, you can plan to travel home the following day. If you have any questions or concerns about the donation process, you can call them and ask more questions. Yeah. Let's see. I think I'm missing one thing. Okay. So here, the question is, what if I'm a match? So if you're determined the people who cut grass are cutting grass outside, so that's why whatever if you're hearing boom boom, that's what's going on. It says, what if I'm a match? So if you're a match, if you're determined to be a suitable stem cell donor, if any of my siblings are, the transplant coordinator would let them know with further information about the timing of the transplant and the family member's current treatment, as well as the insurance approval, because any step they get to, they have to get back to insurance. Oh look, this is where we got to, this is how much it is, should we go ahead? Yeah, stuff like that. So me, I'm just praying that this insurance will just say yes, 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 and yes. Just praying and hoping to God that they approve every single thing, honestly. And then here it says you would need to travel to Dallas for approximately 10 days for the donation process. However, do not schedule travel plans before talking to the transplant coordinator. So before scheduling anything, you have to speak to them, the team. Before proceeding with a stem cell donation, you would have 2 appointments: the donor screening and the donor information session and consents, where all that paperwork and legalities is done. So the donor screening is where the appointment includes evaluation of both arm veins to assess the suitability of blood stem cell donation. Basically, if the donor's arm veins are considered inadequate for donation process, they will talk to them about a temporary IV catheter placement. Basically, if they don't have strong veins, peripheral veins to draw blood from, they might just go in here to put a PICC line on them that goes directly to the heart, or they could put a midline. Still the same thing, it's still peripheral, but it would just be there for that 10 days until they draw out everything they need to draw out. Yeah, which is better if you ask me, because I've had PICC lines and midlines. It's better than just a regular IV. Yeah, for me, I might get a port in my neck where I get, you know, the whole transfusion back into me. Yeah, basically that's it. And then, you know, they'll inform them about everything and all that stuff, and they'll sign, and they're free to say no if they don't want to at the end of the day. Yeah, so that's it. In the comment section, who do you think would be the match for me? Do you think it's David, Naomi, or Ruth? Which one do you think would match for this stem cell process? Let me see your comments down there. Thank you. So I'm gonna keep you guys posted on this procedure. It's a long one. And then, okay, yes, I'm gonna do another video about so yeah, I remember I told you guys in the previous video that I want to have kids, and when I did my own research on this whole stem cell thing, the side effects of this thing is infertility, and it's up to like 82% for women and 74% for men, if I'm not wrong. And I asked my doctor, and he said yeah, but the people that he has done it for, his previous patients, they've not really had that issue. But then what happens is that chemo that is going to be injected into me for like 1 to 2 weeks is going to kill my cells. And you know, the ovaries are cells too, so hopefully, on God, please do not kill my babies, my unborn babies. So just to be on the safer side, I told my doctor, okay, what's up, should we harvest some of it and keep them in the bank while before the chemo? And he said yes. So they already referred me to two fertility clinics, so I have to reach out to them, and then we'll see what can be done. And that one takes another extra time. So basically, that's another hurdle to jump. That's harvesting of the eggs and saving my eggs. So when they save it, let's say I eventually get married to whoever I'm dating now, and we try it, you know, naturally, and we have babies, then yeah. So I'm hungry. Mom is calling me. She sent them to come call me. But yeah, I'm hungry now, like very famished. I have to go get something to eat and get to getting busy with stuff. All right, leave your questions and concerns and your best wishes, if you have any, in the comment section. And do not forget to please like if you like it, but I'm sure you will like it, right? Like, subscribe, and hit that ding 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 button so that you can be notified anytime I post a video. So thank you, and feel free to comment, okay? Yeah, all right, stay tuned, I don't know, put your ears on the ground for when I post another video. All right, I love you guys. Mwah. Is it chef's kiss? Right? Like a, hold on, I don't know these things. Okay. Mwah. All right, okay guys, mwah. Thank you for watching. I'll see you in my next video. You see me in my next video. I'm not seeing you guys. Just being logical. All right, bye.